teenagers, adolescents, can we ask them to give informed consent? Let's start with a clear case. Okay. You have an adolescent, let's say about 15 to 16 years old, in a country where he or she is still considered a minor, and he has a very severe illness, life-threatening, or we can even say terminal, and a decision has to be made. So meaning there's an informed medical decision that has to be made, and the doctors and the institution needs to get an informed consent. It could be anything from continuing a next round of treatment, even if the cost of the treatment or the burden of the treatment or the possible risks are fairly high. The treatment can cause harm, but the non-treatment can also cause harm. So these are significant decisions. Or discontinuing, like prolonged measures, or even going home against medical advice, meaning the doctors, the adolescent medicine doctors and the specialists are telling the patient and his parents they don't recommend him or her going home because he'll get in trouble, or his situation will get worse, or he might even die. So that's home against medical advice. Can you get the informed consent from this adolescent? Or you can have another case, 15 or 16-year-old, but instead of the patient, she is the mom of the patient. She has a 1 or 2-year-old child, and this child is sick with a terminal illness, and the same kinds of decision had to be made. And she's been taking care of the kid. The grandparents are also there, so meaning the parents of your adolescent mom. And the question is, who should give the consent? Those kinds of situations dealing with adolescents are becoming more and more common nowadays. And the question is, can they give an informed medical decision? Or can they legally give an informed consent? Because an informed consent ultimately is a legal concept. You're getting a consent not because you think it's ethical, although that's part of the reason why the law requires it nowadays. You're getting it because it's a legal requirement. So is it legally valid if they're the ones giving the informed medical decision and consent? Okay. Well, first, let's start with who can give an informed consent. Well, informed decision making, the basic idea or the basic requirements is fairly simple. It's the basic requirements of any kind of decision making. For example, you guys are about to graduate, nursing students or medical students, and you're trying to decide whether you want to go into an ambulatory setting kind of career or field, or you want to go into surgery, or you want to go into some kind of subspecialty field, or just go into practice right away. That's a decision. It's a very important decision. Of course, we're not dealing with a life-threatening illness, but it's still a major decision that could affect your entire life, or at least the next 5 to 10 years of your life, unless you want to change your careers later on. Then, what do you need? So what gives you the capacity to decide well? First of all, you don't decide based on nothing, right? So you don't just look at your values and say, well, I want to do this. That would be very questionable. So that won't work in your favor. You should be able to understand the relevant information that you need to make a decision, right? So, like the benefits and the risks of going to this particular field or that particular field, or starting practice, or going to further studies. What will happen to you if you go into this area? So you need the relevant information, but then just knowing the information doesn't cut it, right? So what do you do with the information? Well, you should be able to sit down and think about the information and use your rational faculty and use your basic values and general goals in life to figure out what would make sense for you. You have to think things through, right? You should be able to sort out the information using your values and goals and figure out for yourself what is relevant and what is less relevant, and then try to think things through, right? Finally, you should be able to make a final decision and tell everyone what your decision is, right? So you have to tell everyone. Just making the decision is not going to cut it. Like, if you want to enter further studies, you tell your friends or your parents, and then you go to the school or the training institution, and then you tell them what your intentions are. You have to tell everyone. Same idea. So if you're going to make an informed medical decision and give an informed consent for a procedure or for an action or inaction, meaning you don't want it anymore, you don't want the test, you don't want the treatment recommendation, or you don't want to stay any longer in the hospital, well, you work through the benefits and the costs and the risks, and then you try to sort things out, consider your values, what's very important as far as you and your life is concerned, and then make a decision and tell your doctors and everyone in the hospital and your family about it. That's how it works. Now, if we work with the family system, it's the same idea, except that the family system is the one getting the information, and thinking things through doesn't involve just one person. They talk things over, and personally, I think it still would make better sense if the patient and at least the closest family members, or especially the next of kin or the one who will take over the decision making if ever the patient becomes incompetent, are there trying to discuss goals, values, and agreeing with the final decision. They might not completely agree, but at least they understand exactly where the patient is coming from, and the patient understands where his loved ones are coming from, and hopefully they come up with an agreed upon decision, and then they should be able to communicate that decision with the doctors. It could be a full code, just do full CPR when my heart stops, or don't do CPR, don't resuscitate me, that's a DNR. Or I want to go home, I know that you don't want me to go home, but I want to, so that's home against medical device. Or I don't want that treatment, or I don't want that surgery, or go ahead with that surgery. So those are informed decision making, or informed consents. So that would be the basic consideration. Does the 15-year-old or the 16-year-old have that capacity? And pretty much in an ideal setting, that should be enough, right? So now, what are the legal considerations? Well, consider, not all 15-year-olds, 16-year-olds would have the same capacity of understanding the information, or may not be cognitively or emotionally matured enough to think things through, right? Now, if you go down lower than 15, like what about a 14-year-old? Or what about a 10-year-old? Or what about 7-year-old? Where do you draw the line? Of course. Well, maybe in the future, in an ideal setting, if you have enough people to assess kids and they have enough knowledge base and technology, maybe you can put something on the patient's head to figure out whether they're capable enough to think things through, right? Because there's no way of knowing. All you can do is just sit down, listen to the adolescent or the pre-adolescent, and try to figure out whether you're making sense or not. What's the best thing that we have so far? The best thing that we have so far is the idea of legal age, whether the patient is legally considered a minor or has reached the age of majority, right? So it's pretty much what we have right now for the best that we can do so far. Obviously, the things I've said, like, every time someone makes an informed decision making, an adolescent or a pre-adolescent that looks matured enough, you call up a child psychologist and let him tell you what to do. That's not really feasible, because it's like hundreds of cases and you have to employ a whole bunch of people to do that. And then, of course, the question is, how do they do that? Do they have enough knowledge to figure that one out well enough? Well, not yet. Do we have the technology to help them figure things out? Not yet. So we have the laws defining who's still considered a minor and who's not. When you look through the laws of your country or your state, you might encounter another concept. Like you might say, well, by law, this person's still a minor, but look at what this person is doing. He or she is financially independent. She's working on her own. She's still 16, but she's just doing it on her own. She's not living with her parents, has her own life, or married maybe, or has a kid and has been taking care of this kid for like 1 year or 2 years and it's been doing pretty well, not really requiring the assistance of her parents for big decisions. And you look at this person, this patient, and you say, well, it looks like she can handle this one. She looks like she's matured enough. Consider how she's living, right? So even if she's 16 and by age she's considered a minor, maybe we can say that this patient is an emancipated minor. So that's the idea, emancipated minor. Or look at this 16-year-old parent. She looks like she's been doing well, taking care of her kid, living alone, making decisions for the kid, and they sound pretty good. They sound mature, right? She's pretty independent, so she's a minor, but she is emancipated, very independent, emancipated. So she's an emancipated minor. In some places where the laws are, or the courts and the justice system are fairly decent. Okay, so unfortunately, you might be in a country where things are really questionable or unruly. Like you have a whole bunch of laws, and you look at the way the doctors are practicing, and you look at how they play around with laws and rules and implementing policies which doesn't look legal, and all sorts of things to come up with something to allow them to do something that's actually legally questionable or illegal. You can't be in a place like that. I'm not saying which countries or which places or which institutions, no, but if you're in a place like that, then this idea of a mature minor won't apply. Because a mature minor happens when you have an institution and they have this dilemma about this adolescent patient or adolescent parent, and the case went to court. When the court decides that, this adolescent has sufficient understanding of the nature and the consequences of the treatment proposed, despite his or her chronological age, which is considered still a minor, then the court will say, well, by age, she's a minor, but she's a matured minor, meaning she's 15 or 16, but as far as we're concerned, she's a mature person. So that's matured minor. Now, if you look through laws, or if you consult your medical legal office, and that's my advice, there's no way for you to figure out the new laws and the case laws and what's happening with the law, and you're dealing with a dilemma that can get you in trouble. You don't just open a textbook coming from some other country like, your Southeast Asian country or whatnot, and then you have this books on hospice end of life care, and they tell you about their laws and what they think is ethical in those countries or societies or places, and then you do what you see you don't do that. When you're dealing with the law, you have to be familiar with the law of your country or the law of your state. So if you wade through the laws in your place, you might encounter other things. Like, for example, in some states or countries, they might allow minors to do the following: consent for clinical management or medical treatment of STDs, sexually transmitted diseases, or if they're pregnant, they don't need their mom's consent to be treated. Physical abuse or substance abuse. Now, again, let me warn you, you have to know the law, whether this applies to your country or not. Okay? If there's an emergency medical situation and you can't get a hold of any adult or parents, some countries makes it legal for you to get the consent of the minor, even if they are minors. Like, they're not emancipated minors or they're not mature minors, but it's an emergency situation. Now, of course, if the court says that you're a matured minor or you're considered an emancipated minor, if your country has those kinds of legalities, that's a given. Now, if you're not a matured minor or emancipated minor, but you're dealing with an emergency or pregnancy or physical abuse or sexually transmitted diseases, then some countries or some states would have laws allowing the doctors to accept your informed consent for treatment. Now, let's touch on briefly. This would probably require another set of sessions, but let's touch briefly on the thing that regularly crops up when we talk about consents of adolescents, and that would be Assent. Several pediatric groups, associations, organizations, academies, and adolescent groups and associations or academies for the past 1 to 2 decades have been telling everyone there's this thing called Assent. There's the informed consent, which is a legal requirement, and there's this idea of Assent, which is a recommendation from the doctors or the doctors' groups. The Assent means you have to get the kid or the adolescent to understand what you're doing and to try to get them to agree to what you're doing. It's almost like a consent, except that the one you're getting consent from is a minor. And so we don't call it consent. They just agree. So they assent to whatever you're planning to do or not planning to do. Okay, so legally they cannot make informed consent. So the most critical point here is there's a difference between assent and consent. If you want to make an action or inaction legally valid or acceptable, you have to go for an informed consent. Now, if you want to make sure that you're not harming the kid emotionally and you're treating the kid with respect and dignity, then you go for the kid's assent. So that's pretty much the idea. Meaning, for example, you have a 15-year-old not declared an emancipated minor or not a matured minor. Obviously, the parents are deciding, and there's no situation that would allow the doctors to recognize their decision, like emergency or pregnancy or whatnot, and the doctors are getting the consent from the parents. The idea is the parents and the doctors should also sit down and try to listen to the 15-year-old and answer some of her questions, especially if by giving her information would make her feel better and relieve some of her emotional or psychosocial distress. And that's the bottom line. You're getting the assent for that reason. You're not getting the assent, A-S-S-E-N-T, so that you can actually do the act in a very legally acceptable manner. That's not it. Why is it very important as far as these groups are concerned? Well, because adolescents already know a lot. I mean, they might not be considered cognitively or emotionally matured enough by society or the country to make this decision, meaning her decision for herself is not valid yet because she's not matured yet to make that kind of very important decision. You still have to sit down and talk to this adolescent, answer the questions, and try to explain to her what you intend to do or not to. Imagine if you don't do that, and the adolescent has questions, ideas, and she wants something else, and there's no way for her to dialogue with her parents and doctors, and that's a very emotionally distressed patient, right? So that's usually where it comes in, and it makes sense, right? Especially if you're dealing with adolescents. But you know, the idea of assent also applies to 5-year-olds or 6-year-olds. And usually you'll see this in literature on clinical trials or literature on experimentation and clinical trials involving small kids. And the suggestion is, you know, legally, you also just need the consent of the mom. But if this involves something that causes some discomfort for the kid or some possible risk or harm, also sit down and try to explain to the kid while he or she is getting that kind of stressful or painful procedure. And again, why? Because it would be better for the kid, and you won't have a very emotionally or psychosocially distressed kid. Okay, so that's assent.